Let me ask you this question. Have you been recently diagnosed health-wise, medically, with something and you're going, what is that? And here you are out Googling and trying to figure it out. And you go, man, I wish I had a doctor that I could sit down and talk to that's a consultant and is there to help me understand it. Well, that's what you're going to get today on today's episodes. We are talking about patient advocacy, and we have Dr. Elizabeth Mazel. You will love this episode if you've ever been worried about anything medically.
We hope you've been enjoying all the episodes from Secure Your Retirement. If you'd like to keep learning and receiving these episodes, hit the subscribe button and the bell so you receive alerts when they come out. We've helped thousands of listeners get on the path to securing their retirement. Now it's your turn. Let's dive in.
Welcome, everyone, to Secure Your Retirement Podcast. As you know, Merce and I, as we have been doing this podcast now for a few years, we really try to bring in different types of topics, not just financial things. We do talk about, obviously, how we can leave a legacy and those kind of things. But one of the things that we have spent some time at over the years is talking about lifestyle choices. And that could be a lot of different things. But today, I think you're really going to like the guest that we have on, Dr. Elizabeth Mazel. And we're going to talk about a lifestyle that I think will be very beneficial to you. Before we get into any of that, I just want to say, Dr. Mazel, thank you so much for coming on and talking with us and our audience today.
Thank you for having me.
Great. So we've had a little bit of conversation with you, Dr. Mazel, prior to going into record mode here. So I want to do a little bit of a setup. We have quite a few episodes that we've talked about the aspect of as we get older, we have to start thinking about things like long-term care. And I think most people really get it in their minds that it's as we get older that we're going to get to a point where maybe we aren't able to do some of the things we were able to do when we were younger. I know that and when a person's in their 50s, they're not really wanting to think about that yet, and they're not really wanting to be in that place. But I will tell you that as we've talked about the different options, whether it be a continuous care retirement community, whether a person's going to say, I'm going to go to an assisted living, there is a lot of folks that really like the idea of what can I do to prolong my health as long as possible, A, B, be able to stay at home as long as possible. And I think that's why we were so interested in having you on the show. So for those of you listening, Dr. Mazel has an advocacy practice where she works with individuals to help them in this category. So before we go into a lot of those details, Dr. Mazel, could you give us a little bit of your background and then what has got you to this point today where now you are, however you want to describe it, I'm going to say an advocate for individuals to stay healthy as long as possible?
Sure. I am a family medicine physician by trade. I've been practicing for over 10 years. And over the years, I have dabbled in different types of facilities and practices and started leaning towards lifestyle medicine because I like to focus on prevention and wellness instead of always treating with medications. And I also started learning more about a field called patient advocacy. I know we have them set up in hospitals already, but I didn't realize that a physician could act as a professional patient advocate. And so I became more interested in advocacy than clinical practice because I get to spend more time with patients and affect change in a greater way. And so I have decided to kind of pivot again and focus on patient advocacy and lifestyle medicine to help patients and clients in ways that I haven't been able to before.
Yeah, I think that sounds super exciting and intriguing. The phrase of treat the cause, not the symptom, right, is becoming more and more common. People are becoming more and more aware that there are ways to holistically kind of advance your health without just popping pills and stuff like that. So I think it's a great time to be doing this. So I guess, what is a patient advocate? What does that truly mean? What type of role do you assume in an advocacy type of relationship?
A patient advocate is a professional with some clinical expertise who can help someone navigate the healthcare system, their medical diagnoses, coordinate care, understand their insurance coverage needs, and um, just be someone to help them understand the complexities of their health and wellness in a way that they haven't been able to get in their traditional doctor's office.
Yeah, so I guess as I hear it, I know, and when we were talking to you prior to going on and recording here, you kind of made a point that kind of hit me and resonated is, if I go to my doctor's office, right? Typically, everybody knows how that works, right? I go in, I have the nurse come in, they're going to do all my vitals, and I'm going to get all that thing. They're going to ask me all these questions, then get all the notes, and then finally the doctor comes in. The doctor comes in, and I feel like I'm in a speed dating thing, like I'm going through and they're just like, here, is this the case? Is this the case? And then they give me a thing and they're out. And I'm like, I think they're going to go get something and come back, but they never come back. And, it's like that really fast pace. And you said the difference with having someone in this role is that now I could spend really as much time as I need in order to walk me through. I mean, am I on the right track there?
You're definitely on the right track. We're definitely limited in time in a traditional medical practice. Visits are usually 15 minutes in most traditional practices, and a few of those 15 minutes goes to our medical assistant who's getting your vitals and asking you the reason for your visit. That leaves the doctor with maybe 10 minutes to talk to you, ask you how you're doing, come up with a diagnosis and a plan, and treat you. Um, so, what's being left out are all of your questions, time to discuss, to educate. And so, patient advocacy takes you out of that office, kind of makes you more comfortable, more casual setting. Your mind is freer to think about all the questions you have because a lot of the times you forget them when you get to the doctor's office. It's just a lot happening. So, you can ask all of your questions, um, get some feedback, express your frustrations, and that's something that many patients don't have the opportunity to do in the doctor's office. But one thing you have to remember is in advocacy, there's no patient physician relationship. This is client and consultant. And that's why we have unlimited time. So we're not diagnosing and treating, but we're helping you understand the diagnosis and the treatments that you've received from your doctors.
Okay, well, great. So I like that you distinguish that this is more consultative, because you go into like the doctor's office. That example is they get the data and they make a diagnosis. It's very quick. But I guess what you're saying is let's have a conversation. Let's try to understand all the elements and take the time to really come up with some type of plan going forward. Um, and that's going to take more than 15 minutes, right? So what does that look like in real life? Do you have any examples for us?
As far as a patient advocacy
Yeah,
example,
so if you were to say here's a common type of scenario that I've dealt with over in my past, and from start to finish, maybe they came in and sat down with me and we figured out what type of path, and how'd you help guide them through the whole process?
I had a family come in with their father, a senior gentleman who was recently hospitalized, and he was independent prior to the hospitalization, living on his own, and his adult children were very overwhelmed with all the new diagnoses from that one hospitalization, all the care he was going to need at home, all the follow up appointments, all the new medications that he was prescribed. And they were bringing him back home, going back to their own lives, and had no idea what the next step was. It was just very overwhelming because they lived out of state actually. And so they hired me as their advocate to kind of logistically piece everything together, explain to them how did all of this happen? He was healthy, he was living on his own, and now he's homebound, needs all of this help. And all of these medicines, aren't they bad for him? So I pretty much explained the disease anatomy, physiology, the prognosis, and what the doctors have determined is the best treatment plan for him. I had created a document to help explain all of the diagnoses, medications, what they're used for, something they could refer back to and share with all of the siblings so everyone's on the same page. Also shared it with the client as well so he understands his own diagnoses. And together it's a lot of emotional support. It's a lot of hand holding. It's a lot of educating um, and coordinating care. I helped to make doctor's appointments because sometimes they don't know what to ask, how soon they need to follow up. So I was able to do that for them. and actually be on the line when they call the doctor's office to ask the appropriate questions. So I can actually feed the questions to them or tell them what they need to make sure they ask. Sometimes they're just not comfortable doing it, very overwhelmed or very emotional. So I can do that for them. And ultimately, I'm still working with them now, but I've given them a literal framework on a sheet of paper that they can always reference. They understand why everything is being ordered, imaging tests, medications, follow ups. Um, so that's an actual example of how I was able to help them. And I continue to help them now.
Excellent. So if a person's listening to this and and they're thinking maybe about that type of scenario where I got a parent, I know I just went through this with my mom. Unfortunately, she passed away the first of the year, but we went through that whole scenario that you're kind of describing where we were overwhelmed with everything. Everything was fast moving. My mom was overwhelmed. There was me and my two siblings overwhelmed. So that I really get that side of it as well. And then as I'm listening to you, I think about it doesn't maybe have to be that way. It could be I as an individual am going, hey, I have something. Maybe it's not catastrophic, but maybe it's new. It's a new diagnosis of some sort. And I'm thinking, well, how do I deal with that? So if I'm looking at that, like if I wanted to reach out to someone like you, how does that first conversation, I guess, go to even know if you could help or if you're able to be an advocate? I mean, how does that first conversation really go?
Um, because I'm a practicing physician, it tends to go like, what brings you in today? How can
Okay.
I help you? What's going on? Okay. And we just have a casual conversation. Um, and I glean all the information and determine if that's something I can actually help you with. Sometimes clients are looking for more of a legal support, and they're saying, I feel like I've been wronged, and I need you to look at my x-rays and tell me if this was the real reason. So they're looking at maybe a malpractice issue and they need me to help them in that fight. And I'm not a medical legal attorney, but I'm going to help you understand what happened during your care. I can help you understand the systematic evidence-based approach to physicians in making a diagnosis and determining the course of medical care so that you can be your own advocate and understand that, oh, okay, so this was done correctly. Oh, okay, this does make sense. Or maybe we'll determine this was done out of order or it should have been done another way. So again, a lot of education, a lot of advocacy, and just clearing out all the mud and the confusion and the complexities in healthcare to help you understand what makes the most sense, what was supposed to be done, and letting patients know that they have a right to their opinion and their own decision making for their own medical care.
Yeah, I think that's fantastic because it's confusing, it's overwhelming. Just like in our world of financial planning, retirement planning, investments, all those different things. There's so many facets to it where it could just be a lot if you don't have someone that's there to advocate for you and knows that world very well. So I know when we were talking before we started recording, you mentioned more of a passion of yours, I guess, on the creative side of, and Raiden mentioned, that we've got some people that want to go to continuous care retirement communities as their kind of their final leg into that stage of their life, and then others they don't want to leave their house. Right, this is the place that I raised my kids in. It's debt free. I love this place. I don't want to leave it. And so you mentioned that you kind of help people think that through a little bit as far as aging in place. So tell us what a little bit about that side of your business and what that looks like.
Just a little bit of background. My mother has advanced dementia, and so I had to move her into my home for 3 years, and I was her caregiver. So that took a lot of transitioning from her long-term care into our home, and we had to make sure that she was safe and that she was comfortable. So I had my own experience of transforming our home from a two-person middle-age home into a safe space for my mother to move into our dining room. We transformed a dining room into her sanctuary. All the things that she loves, that she enjoys, she likes to look at. Um, and things that her caregiver could use when toileting, bathing, cleaning, eating, all the things in one room. And so I realized this is a big need, especially for aging seniors who maybe they can't afford to go to long term care, or maybe they want to stay home with their families. Maybe their families have the resources and the spaces to move them in with them. Um, but there is a right and a wrong way to do that. You can't just make everything beautiful. They have to be functional and they have to be safe. We think about flooring and preventing falls and slips. We think about grab bars, handles, walk in showers. There's a lot to think about, making a safe space when you want to age there and not just be bored and stare at plain walls, but enjoy it as well, and feel like you're home and you're not in a sterile space or facility. So that is the lifestyle portion of Palm Wellness. And it focuses on the lifestyle medicine pillar of environment. So that's why I wanted to introduce that into my business as well.
That's excellent. So if somebody's listening to this and they go, wow, this, because we're having obviously a very brief conversation here, but if somebody were listening to this and they said, man, this sounds like something I would like to have a conversation about on, and, and I guess just let me ask, how does that work? If I was listening to this and I go, I'd like to have a conversation with you, what would be my steps? How would I do that?
Sure. You would start off by going to my website, www.mypalmwellness.com, and just schedule a consultation with me. And that initial consultation is about 20 to 30 minutes. And we just discuss everything that you're concerned about, more about me and how I can help you needs, and see if we're a match. And if that's the case, then we can either do hourly consultations or do a large package, and then I just work with you over a long period of time. I have a lot of clients that book me for months, 6 months, or just indefinitely to just be a part of their healthcare journey.
All right. Well, fantastic. Well, if you're listening and this is something of interest to you, then we will make sure we have the website listed in the show notes as well. But Dr. Mizell, thank you so much for coming on. It seems like you've got a lot of experience in a lot of different areas when it comes to this. So I think anyone that works with you is going to benefit some way, somehow, even if they just have that initial conversation with you. So thanks a lot for your time.
Thank you for having me. It was been great. Thanks.
We hope you have enjoyed this episode of Secure Your Retirement. If you would like to learn more, we have actually created an online course called 3 Keys to Secure Your Retirement. This video course helps you to think through all the different steps as you get ready to plan for and live throughout retirement. You can access this by going to our website, pomwealth.net. In addition, you can also subscribe below to our podcast called Secure Your Retirement.
For more retirement tips, check out these videos. Also, if you find them valuable, please subscribe to our YouTube channel and give us a like.